Welcome to Shining Waters Yoga. This class is the first class in a series for chronic low back pain. There have been a lot of studies, a lot of research around yoga therapy, the benefits of yoga therapy for chronic low back pain, and it has been found to be an efficacious adjunctive treatment for low back pain. That being said, this class is not meant to be a prescriptive treatment. It's not meant to take the place of any recommendations by your doctor or your physical therapist. You should always check with your physician and make sure before you embark on any exercise program. That should go without saying, but as we move through this practice, of course there are many different causes of back pain. And some of you watching may also be dealing with other comorbidities, other issues in your body. So we're going to move slowly, we're going to move mindfully. Please take care of yourselves and remember that you are in charge of your body. This is your practice. So anything that we do that doesn't feel right for you, skip it. You might take smaller movements than I do. You might move more slowly. You might stop and rest. You might go back to something we've done previously, but never move to the point of pain or strain. This first practice is going to be very gentle. In fact, it's all going to be on the floor. We're not doing any standing postures today. We'll do some breath work. We'll do some mudra. We'll do some guided relaxation at the end of each of these practices. I can't overestimate the importance of rest. So if you're dealing with pain of any kind, the body can only heal when it's resting. And so if you're not getting enough rest, of course, the body's going to just keep holding on to these patterns of tightness and tension. So that being said, I want to talk a little bit about different things that can cause back pain. And it's important that you become aware and mindful in your life of things that you're doing that might be exacerbating your pain. So of course, repetitive strain in your work life, your home life, poor posture habits. A lot of us tend to sadly be looking at computer monitors all the time and or cell phones and getting into these rounded positions. So being aware of our posture, and yoga, the practice of yoga, can cultivate the mindfulness that we need to be aware of these everyday habits and correct them. I think that sadly in our society, we tend to want a pill to fix everything, and we don't want to actually change our habits. So becoming mindfully aware of the things that cause us pain, or things that we might want to, behaviors we may want to change, is an important part of healing. Getting rest, as I said, is also important to our healing. And then being aware of if you have undiagnosed back pain, you're not sure what's causing it, definitely, I highly recommend seeing a doctor. If you have a diagnosis, then you know what you're dealing with and you can seek appropriate help. Severe issues like severe disc degeneration or severe scoliosis. Minor scoliosis, you may get through this practice pretty easily, but it's always good to have a yoga therapy session, a private session with a yoga therapist, if you're interested in yoga therapy to help you with different kinds of chronic pain. Because a therapist working with you one-on-one can really help you avoid things that might not be good for your condition, as well as point you in the right direction to things that might be the most helpful for you. This class is meant to just be a generalized class, so I will offer some modifications as we go along, but again, if you want the best practices for you and you're dealing with more severe conditions, I highly recommend an individual session with a yoga therapist. I am a yoga therapist. There may be yoga therapists near where you are, so that's a possibility as well. As I said, there's a lot of research showing the benefits of yoga therapy now for chronic low back pain. I'm incorporating some of those some evidence-based practices in this class, as well as some things I've learned from my own experience with back pain. I deal with a herniated disc in my lumbar spine, as well as issues like arthritis. So definitely this has been something that I've taken into my own life for my own healing, and I've seen the results. But what works for me may not work for you. So we come back to that central theme of mindfulness, move mindfully, be present, take care of you during these practices. So I think that's all I wanted to say before we start, other than just talking about some props. I didn't want this to be, you don't need anything elaborate for this practice. Hopefully you have a yoga mat or even just a rug, some padded surface that is non-slip, non-skid, for when we do some standing postures and other practices, not today. A little cushioning under the knees is going to be good. You might want a blanket. So I'm sitting on a blanket now. It can be any kind of blanket, doesn't have to be a yoga blanket. And just folding that, giving you a little bit of padding, can actually be helpful for when we're sitting, as well as to pad your knees when we're on all fours. We will do a little bit of four-footed postures today. And then have some things for support for final rest. So as I said, we will end with rest. I happen to have a yoga bolster, but you can use pillows. You can use couch pillows, bed pillows, just something to put under your legs to support them. You could even put your legs up on a chair if you wanted to at the end. You might want a blanket to cover with when we come to final rest. Some people like to have eye pillows, but again, those are all just extras. The main thing is that you just need you. You just need to be present and aware. So as we get started, and if you have a block, have that. I'll give an option for a restorative posture in the end where we can use a block. But if you don't have a yoga block, don't worry. You could use, again, a firm cushion, something like a bolster or a couch cushion, not a fluffy, mushy cushion. And if you don't have it, don't worry. Again, it's just one posture. I'm going to give an option for a more active version of bridge posture and one that's more restorative. So you can choose what you want to do and maybe do the restorative version at another time. So let's get started. We're just going to sit for a few moments, and know that you don't have to sit like me. You don't have to cross your legs. You could start seated in a chair. Just want to be present for a moment with our spine and just feel in and notice how we're coming to the practice today. So right away, starting to cultivate that sense of mindfulness. And it can be helpful to sit on a cushion because, especially if your pelvis tends to round backwards or tilt backwards. So we don't want to round in the lumbar spine because that right away is going to create pressure here on our lumbar spine. By sitting on this little bit of cushioning, it's going to tilt my pelvis, rock the pelvis forward a little bit, and help me to sit up a little bit taller. So most of us naturally have a little bit of curve here in the spine. Some of us don't, again. That can be right there, something that might cause back pain. So we're trying to encourage just our tallest spine, thinking about lifting, spinal extension, creating space between the vertebrae. And then softening through your shoulders. Thinking about the spine extending all the way up through the crown of the head so that you're not tilting forward with your head, but allowing your head to be in line with your spine, and maybe even encouraging a slight tucking of the chin. Take a moment to just check in, feel in to your body, noticing your starting point. Where do you feel discomfort? Is it difficult to sit up straight? And start to feel your breath. So we'll take a little mudra here, a simple mudra. It's just making a fist with your hands and your thumbs up. So it's like you're giving someone the thumbs up and then placing the pinky side of your hands down into your legs. And even just by gently giving a little press down, you might notice that this helps to encourage a longer spine, encouraging you to sit a little taller. And if you're seated in a chair, again, you can just have the hands in your lap and sit up a little taller, maybe. Holding that mudra. Start to feel your breath in your belly. See if you can become aware of that. You can close your eyes if that's helpful, or soften your gaze. But feel your breath as you're breathing in down into the lowest part of your lungs. And so as you take that breath in, diaphragm's pushing down on the belly expands. And as you exhale, the belly softens. Focus on that region today, and we'll be moving up into the higher sections of the lungs as we go along. But really just being aware of the lowest part of your lungs as you breathe. And feel your breath in the front of the lungs, the sides, and in the back if you can. Can you feel your breath in the lower back? And it's okay if you can't, but just noticing that, taking in some information. This is our little self-assessment this morning. See if you can find an evenness in your breath, samavritti, the even breath. So if it's helpful, you can count your breath in, 2, 3, 4, exhale, 2, 3, 4, inhale, 2, 3, 4, exhale, 2, 3, 4. See if you can slowly over time cultivate that to 5 or 6 count. But don't force anything. So find the count that works for you today. And this is going to guide you through your practice. As you breathe in, 2, 3, 4, or 5, see if you can pause for just a count or 2 at the top of the breath. Hold the breath in. And then exhale the breath out. 2, 3, 4, and pause at the bottom. So you start to notice this rhythm to your breath. And you start to become aware of where your in-breath begins. The sensation of the fullest part of the breath. Where you start to exhale. And the sensation at the bottom of the breath. We'll just take 2 more breaths like that, inhaling. And as you exhale, actively draw your belly in this time. As you force the breath out. Notice how that feels. Breathing in. As you exhale, draw the belly in. We're going to do more of this later on all 4s. So draw the belly in, let all the breath out. And release. You can open your eyes if they're closed, release your hand mudra. And we'll come onto our back. So you can move your blanket aside, coming down off your chair if you were sitting in a chair. So we'll be here for a little bit. Make sure that you have room to move. That's always important. And we're going to be on our backs with our knees bent, our feet on the floor, our heels right in line, right underneath the knees. And knees and feet are about hip width apart. So my feet aren't really wide apart or close together, but just in line with the hip bones. And pretty close into your buttocks. Let your hands rest by your sides. And actually we're going to take the heels of the hands right to the tops of the thighs where the thighs meet the hips. So that little crease there. And we're going to press the heels of the hands into the thighs as we inhale. Maybe noticing a little bit of arching in the lower back. And then as you exhale, release that. Let go of the pressing as you exhale. Just let the low back release. As you inhale, press actively into your thighs, letting the lower back arch, sensing that stretch in the back muscles. This is called pelvic rocking. It's a small movement. As you exhale, release. You want it to be gentle. And just noticing right here, as you press into your thighs, inhaling, does that feel good or not? So
So that little bit of gentle arching might be helpful to some people and not to others. Exhale, release. Some of you, keep going at your own pace. Some of you might not feel much of anything at all. So if your pelvis is naturally tilted backwards, it's going to be really hard to get it to tilt forward just by pressing into your thighs. But imagine the movement. Imagine your lower back lift off the ground and the tailbone pointing down as you press into your thighs. So the pelvis actually tilts forward. As you exhale, it comes back and just releases onto the mat. We'll do that one more time. This time, a little bit different. Inhale, press into your thighs, the lower back arches. Hold that, keep pressing into your thighs, but go ahead and exhale. All the breath out. Take another breath in. Still pressing into the thighs, keeping that arch. And then on your next breath out, release. Notice how you feel. And then from here, we're going to go ahead and draw both knees into the chest. So if you can take your hands to your shins, or some people might be more comfortable on the thighs, but give a little squeeze here. Notice how this feels. You might do a little gentle rocking if that feels okay. We're compressing the abdomen here, lengthening through the low back. Don't lift your hip up when you do that. So you don't want to grab your knees so forcefully that you lift your hips off the ground. Think more about keeping the tailbone pointing down towards the bottom of your mat. And then another small movement here, taking your hands to your knees. As you inhale, push the knees away. Let your feet just dangle. Don't let them come all the way back to the floor. So there's a little bit of core engagement here. As you exhale, draw the knees back in. Move with your breath. All the breath out. Remember drawing the belly in. Inhale, move the knees away. 2, 3, 4. Exhale, draw the knees in. 2, 3, 4, or 5. I'm going to move super slow, so you might go a little bit faster than me depending on your breath rhythm. We want to be mindful. We want to move slow. Exhale, come back in. Inhale, move the knees away. Let your feet dangle. You might feel a little bit engagement of your core here, your lower belly. Exhale, draw the knees in. Rock a little bit side to side. And then we're going to extend the legs up to the ceiling. So finding a straight leg. I'm not drawing my legs toward me over my head, but just straight up. You can flex your feet. It might feel good to stretch the legs after all of that. On your next in-breath, we're going to bring the feet back down to the floor, knees bent, and reach your arms overhead. So notice here, if you have shoulder injuries, you might not be able to reach all the way up. You might just take a sort of a cactus pose with the elbows bent. So find a posture that works for you, but this is going to be our inhale position. Arms overhead or out to the sides with bent elbows. As you exhale, bring the arms down, draw your knees back in, and extend your legs up, flexing the feet. Moving with your breath. On your in-breath, bring the feet down, reach the arms overhead. Feel that arching. So just like before, as we inhale, the back is going to arch a little bit, maybe more so for some than others. Exhale, arms down, draw the knees in, and then extend the legs. So we're not just taking the legs straight up. We're going to bend the knees and then extend. Bring the feet back down, inhale, arms overhead. You could really do this as many times as you like. Exhale, but moving slowly, bring the arms down, draw the knees in, extend the legs. We'll do one more of these right now. Bring your feet down as you inhale, arms overhead. As you exhale, bring the arms down, draw the knees in, extend the legs up. Pause here for a breath or two. It might just feel good to extend your legs. And then as you're ready, bend the knees, bring your feet back down. Make sure they're still in line with your knees. So check for that. Knees still hip width apart, feet hip width apart, close to your glutes. I can actually touch my feet. So if your feet, we're gonna do a little baby bridge here. And if your feet are really far away, it's gonna be hard to lift your hips up, and that's gonna actually put some strain on your back. So walk those feet in. This is just a baby bridge, a rhythmic movement. Again, remember, if it doesn't feel good to you, you're not gonna do it. You're gonna skip this one. You can come back to what we just did and just keep going with that. So from here, arms at your side, palms down. Pressing down into the floor with your feet. As you do that, notice your hips kind of wanna lift up. So release it back down. And let's do that again. Root down through your feet, press down. Hips wanna lift. Inhale, see if you can lift them up a little bit more, reach your arms overhead. As you exhale, roll your spine back down, let your hips rest. Nice and slow and controlled, bring your arms down. So that first one, notice, if you felt any discomfort, just stop. Maybe go back to the extensions. If you feel okay with it, root down through your feet, lift your hips up any amount. Maybe you stay here and leave your arms down and then lower down. If you're okay with the full movement, press down through your feet, inhale, lift your hips, arms overhead. Not your biggest bridge. Exhale, slowly roll the spine down. Let your hips rest, let your arms come down. Don't turn your head to the side. So if you're not sure what I'm doing, watch first and then do it. Don't try to turn your head to the side when you've lifted your hips up, because that's gonna strain your neck. So rooting down through the feet, inhale, lift your hips any amount, just a baby bridge pose. Arms lift up. Exhale, roll your spine back down. Try to feel that control of the muscles as you come down. And if it feels difficult to do that, again, that might be telling you where there's some weakness in the muscles around the back. So let's just do one more. Root down through your feet. Inhale, lift your hips. Spine, arms in that order. Exhale, slowly roll the spine down. Let the hips come down. Let the arms come down. Rest, pause. You can let your knees actually fall in towards each other and support each other. Take a breather. And then one thing I forgot to say at the beginning of the class, if you have a wall space, that can be really helpful for the next movement we're gonna do. You're gonna stay on your back, and I'll demonstrate this two ways. You can do it right where you are on your mat, so don't feel like you have to get up. But if you have a wall, you can take your feet to the wall. Same thing, just like we were in straightening your legs now into Shavasana. And notice right away, does this feel okay on your back with your legs straight? Because it may not for some folks. And that again is information for you. So we're gonna basically draw the right knee into Ardha Apanasan, or half Apanasan. Ardha is the incomplete posture. Just drawing the right knee in and extending that left foot. So if you've got a wall, you can press your foot into the wall, really extending that leg. You'll feel that stretch also in the back body. And then you're drawing your knee in. And even if it's difficult for you to be in Shavasana, this posture might actually feel okay with one knee in and one leg extended. So check for that. And if not, of course, you're gonna release it. And then we'll switch sides. I'm gonna show this again at the wall, and then I'll show it the other way. So as you inhale, actually you might wanna draw your left knee in first, so you come in from the bent knee posture. Exhale here. And then as you inhale, extend the right leg. You're gonna press it into the wall. You might have to scoot a little closer to the wall. Push your foot into the wall, extending that leg. Feel the stretch in the front of your right leg, but also in your back. And then exhale, drawing that left knee into your stomach, your chest, your belly. You're compressing the belly. Let all the breath out. And then we're gonna switch and do that one more time. So on your next exhale, draw both knees in. I'm gonna show it. If you don't have a wall space available right now, from this knees drawn in, you're gonna extend the left leg, press through your heel. Pretend that you're pressing your foot into the wall. And on your exhale, draw your right knee in. Take another breath here. And exhale. Ardha Appanasana. One more in-breath, reaching through that left foot. On your exhale, draw the left knee in. Next in-breath, extend your right leg. Again, pretend that you're pressing that foot into the wall. If you really tighten your hamstrings, you might notice it's hard to flatten that leg down, so your knee might stay bent. But as best you can, again, that's where it's really helpful to have the wall to press your foot into. Draw that left knee in. And then again, draw both knees in, rest here for a minute. If you like to rock side to side, you can do that. You could also do a circling motion with your knees, this little tiny circle. You'll feel this motion around, again, the lumbar spine, the tailbone, the very bottom of your spine. So it could feel really good. If it doesn't, obviously, don't do it. And then reverse the direction. It's like a little massage movement. But if you've got an acute injury there, then this may not feel good. You might just want to ice and rest. So always be mindful with what's going on. We so often, I feel like in our culture in the United States, we force ourselves to do things that we should not be doing. The more we tune in and listen to our bodies and start to develop that relationship, it's like we're befriending our bodies. Our bodies give us information. When we don't ignore it, we can learn something. So I'm just checking my notes because I want to make sure I don't leave anything out. But I think we're ready to come into some somatic movement. So this is, one more thing. Actually, see, it's good I took my notes. We'll come into a little side stretch, and then we're going to do some somatic movement. So all of this is on our backs. So once again, if it's okay with extending your legs, you're going to extend them out and start to walk your legs over to the right. Now, they're not going to go that far with being extended, but as far as you comfortably can. And then again, if it's okay, if it feels okay, stack your left foot over the right. So you're going to cross your ankles. Your upper body, you're going to interlace your hands behind your head for support. So it's like you're laying in a hammock. The backs of your hands, the backs of your arms are resting on the floor, and your head is resting in your hands. So I'm not lifting my head up at any time, okay? Everything's down on the floor. Take a nice deep breath in. And as you exhale all the breath out, you're just gonna slide your upper torso to the right as best you can. So imagine your body is sort of making a banana shape here. You can think of this also as Ardha Chandrasana, the half moon posture, the standing half moon posture, not the balancing half moon posture. So just as if we were standing and taking that side bend. As you breathe, imagine breathing into the whole left side of your body. So feel that stretch on the left side, filling your left lung, front, side, and back. As you exhale, imagine the breath leaving the right lung. So imagine that right side softening. And do that again, breathing into the left side. Exhale. Imagine softening the right side. You might not feel any more movement, but just using this visualization. And then inhale, come back to center. Slide the head back to center. Uncross your legs. We're going to do the same thing on the other side. So you're going to just walk your legs slowly over to the left. Take your time. Cross the right leg or the right foot on top of the left if that feels okay for you. If not, you can try it with the feet unstacked. Won't be quite as deep a stretch, but that's okay. Take care of you. Take a deep breath. As you exhale, you're just going to slide your torso. And you might have to lift up a little bit to slide. Slide your torso to the left, coming into this banana shape with the body. And then begin breathing into that right side that we're stretching this whole right side here. Breathing in. As you exhale, imagine softening through the left side. 2 more breaths here. And as you come into this side bend, again, especially if you have some curvature in your spine, you may notice some discomfort. So don't force it. Again, scoliosis is a condition I really highly recommend working with a yoga therapist, because there's a lot of wonderful things you can do for scoliosis. Some of these postures might be beneficial to you, some may not. So really listen to your body. And then inhale, release back to center, uncross the legs. Draw your knees back in, let your knees fall together for a moment, pause and rest. This neutral position. So we're going to come into some somatic movement with the breath. I'm going to start with the right arm out since it's facing you, and then I'm going to switch around so you can see me, and I hope I'm still in camera here. So right arm out to the side so that the right shoulder is open. And then you're going to extend your right leg, but keep your left knee bent. And the first thing we're going to do is just press down through the left foot. Notice when you press down, just like we did in bridge pose, your left hip wants to lift up. That's okay. Because what we're going to do is come into a twist, and I suggest watching this first before trying to do it. So left hand is going to rest right at your right shoulder, the front of your right shoulder. You're going to take a breath. And as you exhale, you're just going to slide the left hand towards your right as you come into this twist. Your head will probably lift off the floor. Try not to let your knee come over. So I'm not twisting and letting my knee cross. Instead, I'm going to keep pressing down through that foot, rooting down through the foot. Your hip can lift up, but keep your knee pointing to the ceiling. And your hand may not slide as far as mine. So if you're really tight in the upper back or you have a bigger torso, you might not be able to reach all the way. That's okay. And then you're going to come back to center. So this is our starting position. Now, one more thing I want to mention, as you saw, as I twist, my head kind of lifts up. So if that causes some discomfort in your neck, you might want to have a folded blanket. This is where that blanket comes in really handy. You can use it for multiple things. You might support your head with that. And then again, when you're ready, finding this position, left knee bent, root down to the left foot. On your exhale, start to slide that left hand towards the right. It might even slide right over top of your right hand. And see, now I've got this blanket supporting my head. It makes it a little bit easier. On the inhale, you're going to just slide back, keeping contact between your hand and your arm. Come back to the starting position. So we'll do this a few times. Exhaling, slide left hand to the right, coming into this twist. Keep rooting down through your foot. Check for that. Feel the twist in your back. Inhale to release. So the inhale is the release here. Exhaling, sliding your left hand to your right. We'll do 5 times on each side. You could stop and pause and do as many as you want. You might notice as you repeat this, you might get a little bit more movement. So this is a nice one because you can sort of check yourself. Inhaling, coming back to center. As you exhale, sliding that hand towards the other one, can you slide a little bit farther so you can actually see over time? And you could do this maybe even up to 10 times on each side or more. And do it on a daily basis, seeing as you start to improve your range of motion. So let's go ahead and switch for today. We're gonna draw the right knee in, right foot on the floor, and extend your left leg straight out and your left arm out to the side. Now I'm gonna turn around so that I'm not turning away from you. And I'm gonna bring my little pillow with me to support my head and my neck. So settling in. Now that I've turned around, I have to remember what side I'm doing. Left arm out, extend your left leg. Right knee's gonna stay bent. Right foot is right under your knee for support. You're gonna root down through that foot. And you can always check that first, root down. Notice when you press down, the hip kind of wants to lift up, but we're gonna keep the knee nice and steady. Right hand lays right on top of your left shoulder. Take a breath in. As you exhale, slide your right hand down your arm all the way as far as you can go. And then inhale, come back to center with your torso flat on the floor. Taking a breath in. As you exhale, slide your right hand towards the left. Maybe sliding it right over top that palm. Inhale, coming back. Move with your pace of breath. Don't cut the breath off, so stop. You might pause at the top of the breath. Exhale to slide the right hand towards your left fingertips. Pause at the bottom of the breath. Inhale to come back. Again, exhale, slide that hand towards the other. And I've lost count. I'm going to do 2 more. I'm not sure if we've done 3 or 4. Inhale, come back to center. Lots of things to think about here. You're rooting down through your foot. Taking a breath in. As you exhale, you're sliding that right hand towards the left. Pause at the bottom of your breath. Inhale to slide back. I think that was 5, so we'll go ahead and rest here. Relax the arms, draw the knees in one more time. A little compression to the belly, maybe rocking side to side. Notice how you feel. So a little bit of twisting there for the middle and the upper back, all the way down to the lower back. Again, when we have pain in one area, oftentimes there's trigger points also involved. It can be good to stretch the whole back. When you're ready, roll over to your side and very slowly, again, taking your time, walk yourself up. We're gonna come to all fours and do a few postures there, or a couple postures there. So if you have any discomfort in your knees or being on your knees, you might want to pad up with a blanket. Usually that will help to take care of things. And again, moving mindfully through these transitions, oftentimes it's when we move from one posture to another. We're moving really fast, we're trying to get somewhere to catch up, and we end up injuring ourselves. So be mindful about that. A couple things about this 4-footed posture. The knees are going to be hip width apart, the hands are shoulder width apart. If you have arthritis and you can't put pressure on your hands, you might try fists. Sometimes that helps me, or you might just take a break, shake out your hands. You could also come onto your forearms, which is going to create a little bit lower position, so be mindful how that feels in your back. We're going to do this Viagra, the tiger breath. So you could also, if all else fails and you don't want to be in the 4-footed posture, you can do this seated, and I'll show that. So our in breath, we're going to lift the sternum away from the navel, drawing the shoulders back. You can lift your chin a little bit, but don't take your head way back. So think about this movement from the abdomen. You're inhaling, sternum away from the navel. So arch in the spine. As you exhale, think about drawing the belly in, just like we did earlier. Pull it in, pull it in, pull it in. You don't have to do a big rounding in the back if you don't have that capability, or if you have weakness in your bones like osteoporosis and you don't want to put a lot of pressure there. It's going to depend. If you have a healthier spine, a little more movement, you might take a deeper rounding. So just want to say those things up front. Again, we're going to move slowly with our breath. Inhaling, sternum away from the navel, looking forward. As you exhale, drawing your belly in, all the breath out. Inhale, lifting the head, looking forward, sternum away from the navel. Exhaling, drawing the belly in. All the breath out. 2 more times. Inhale. Looking forward, sternum away from the navel. Exhale, draw the belly in. Inhale, look forward. Sternum away from the navel, a little arch. Exhale, draw the belly in. Release the breath out. We're going to modify this a little bit now. So inhaling, come back to
the forward posture, sternum away from the navel. This time as you exhale, drawing the belly in, but we're gonna start to shift their hips back toward the heels. So if you're really tight here in your hips, or if you've got issues with the knees, flexing the knees, you might just come back a little bit. Draw the belly in. If you're able to come all the way back, hips towards the heels, come all the way back. Notice how that feels in your spine. So there's some extension here. Inhale, come back to the first posture. So this is Chakravakasana, moving back and forth. Inhaling. Exhaling, draw the belly in, hips back toward the heels. Again, if this knee flexion, this deep knee flexion is not for you, then just repeat the first part that we did, the Viagra breath. Inhaling forward, exhaling, draw the belly in, hips back toward the heels.
Move slowly, move mindfully.
One more time, inhaling, exhaling. If you're able to come back and this is comfortable, go ahead and pause here. So some folks can bring their head down, the nose between the knees. Some of you may choose, especially if your hips are more lifted and more tight, you might try taking your knees a little wider apart. You might place a block if you have it, or even a pillow if you don't have blocks under your head. Making space for your nose, of course. You don't want to muffle yourself. You want to be able to breathe. So, and the blocks have these different levels. So make yourself comfortable. And notice, of course, how does this feel? So this is technically a forward bend. For some folks with chronic low back pain, the back bends feel a little better. You get a little more relief from that. For some folks, the forward bends feel a little better. So be mindful. If it's not comfortable, you may not want to come into the full folds. As you pause here and take a few breaths, you might find that you're able to find a little more ease in the posture. So again, everybody's different. Take one more breath here. And exhale it out. So we're going to explore the back bends now on our belly. We're going to slowly come down to our belly. I'm going to move my blanket out of the way. Make room, make space here. Come all the way down into the belly. And again, noticing right away. So being on your belly, does that cause discomfort in the lumbar spine? You might try laying all the way flat and resting your forehead on the backs of your hands, like so you have that space to breathe. Wiggle the hips side to side. Untucking the toes. And then engaging the muscles of your legs by hugging the outer ankles in. Feel how that really engages your leg muscles. Rooting down through the pelvis. We're going to actually go ahead and take your hands now underneath your shoulders. You might have to turn your head to the side for this, and then be mindful of your neck. Imagine drawing your shoulders back and down, so engaging the shoulder blades. And just inhale, lift up here, lift the head and the chest up just a little bit into a little baby cobra. And all I want you to do here is feel for this very tiny lifting up back bend. Does that feel safe on your low back? Are you feeling compression there? So the smallest possible lift here, looking forward, not taking your head way back. Breathe in, feel the breath in the belly. Maybe that lifts you up a bit more. Keep your legs engaged, protecting the lower back. And exhale, release back down. Maybe turn your head to the other side. I don't want to turn away because you won't hear me so much. You could also take your forehead down if that's more comfortable. And then once again, let's just try that. Engaging your shoulder muscles back and down. Inhale, lift your head and your chest, just a small amount. I'm not even pressing into my hands. I could even lift my hands off the floor. Elbows are in close to your body. Bhujangasana. Baby Bhujangasana. As you exhale, rest your head back down in whatever way is comfortable.
So noticing that right there, we're gonna actually come into a little bit bigger lift. We're gonna slide the hands forward now to a Sphinx pose, elbows underneath the shoulders. And notice, so I'm lifting up a little bit higher now. How does that feel in your lower back? If you feel like there's any compression, you're gonna come back down to what we just did. If you're okay with it, imagine that you're drawing the front of your mat towards you, and that's gonna help to lengthen your spine, look forward. So imagine, again, creating space between your vertebrae. This might feel really good. So again, this is where everyone's different. I mentioned I have some herniation in my lumbar spine. Back bends feel really super good to me. Looking forward, when I do them correctly, and I'm lengthening through my spine, creating that length, not compressing the lumbar spine. And just staying here for a few breaths can be really therapeutic for me. But again, you may be different, so you have different options. Feel your breath as you exhale from the belly, drawing in. Take one more in breath. And as you exhale, let's come all the way down. We're gonna bring the arms out to the side now like a cactus. So the forearms are down, palms are down. Turning your head to the side again, or you could take the forehead down. This tends to be kind of uncomfortable. One thing I didn't mention is that if you have a little, like a hand towel, a small towel, or you could use a bigger towel, but just roll it a little bit. You can place a rolled towel here, and that will lift up your forehead so that your nose isn't smushed into the mat. But I don't have one right now to demo with, so just know that's a possibility. Or if you're okay with it, if your neck is okay with turning to the side, you can do that as well. From here, with our arms down, we're going to inhale, again, just lifting the head and the chest a little bit. Feel for that. On your exhale, come back down, maybe turn your head to the other side. As you inhale, lift your head and your chest, looking forward. Don't jut your head way back, just looking forward to maybe that edge of your mat. See if you can lift your right leg this time. Just a little lift, it doesn't have to be high. Think more about length and height. So we're working on a little strength here. If this is too much, just come back down. You might skip this. You might just rest on your back, because we're gonna come back onto our backs in a moment. Again, inhale, lift your head and your chest, lift your left leg, just a little bit. Length, think about length rather than height. Don't lift it high. Exhale, come back down. Do this a couple times, alternating legs. Inhale, lift your head and your chest, lift your right leg, lengthen, lengthen, lengthen. Keep the left leg, the leg that's down, strong. Exhale, back down. Inhale to lift your head and your chest and your left leg. Exhale, back down. Remember to use your rhythm of breath. If you can. Don't force anything, but if you can, you're inhaling, lifting up, right leg, 2, 3, 4, whatever your breath pattern is, hold at the top, exhale, 2, 3, 4, everything comes down, pause. Inhale, 2, 3, lift the left leg, 4, 5, 6, exhale, 2, 3, 4, everything is down, pause. Let's do one more each side. Inhale, lift the head, the chest, the right leg. Exhale. Last one on the left. Inhale. Exhale. And then pause. You can rest. You can stack your hands, rest your forehead once again. We're going to come back on to our backs. Make sure I don't forget anything here. And I want to have time for final rest. So go ahead and come onto your backs, with your knees bent. Take a moment, just check in, notice how you feel. And we'll get our props for final rest. So you might want a pillow for your head. You might want a blanket to cover with if you haven't. You might want some pillows this time. I'm just gonna use my holster because I happen to have one. And I'm gonna grab a blanket because my room is very chilly. So if you have a pillow or two, you might, if they're fluffy pillows or squishy pillows, you might want a couple so they give you more firmness. And you can place them under your thighs so that as you come onto your back, the weight of your legs is supported and it's not on your low back. Your low back's not taking the weight. I was going to do a restorative version of bridge, but we're going to run out of time, so I will put it in the next one. You can come back and watch the next one. I want to make sure that we have time for rest. So make sure that you're cozy, that you're warm. Just come onto your back, that your back is supported and comfortable. And if you can lay on your back with the legs, again, supported, this can be a nice symmetrical way to just release everything. Your head supported, your neck supported. Once you're settled in, start to feel all the points of contact between your body and the floor. Backs of your feet, your heels maybe, the backs of your legs, your hips, your shoulder blades, elbows. Your palms can be, or your arms can be by your sides, or you might place your palms on your belly if that's comfortable. Your back of your head resting on your blanket, or your pillow, or your mat. And then feel your breath in your belly. Feel the belly expand as you inhale. As you exhale, feel the belly soften and feel all those points of contact between your body and the floor also soften. Breathing in and expanding with the breath. As you exhale, feel everything drop in a little bit deeper, a little bit deeper, a little bit deeper. Your whole body be supported by the earth beneath it. Take a moment to notice how relaxed you feel, or is there still tension or discomfort? On your next in-breath, filling up, expanding all the way out to the edges of your body. As you exhale, see if you can double your amount of comfort. Can you release a little bit more? And take 2 more breaths like that. Breathing in, expanding, and breathing out and softening. Breathing in, expanding. Breathing out and softening. Begin to move our awareness now through the body, and as I name each part of the body, move your awareness there and see if you can allow that part of the body to release a little bit more. We'll begin with the right hand thumb. The index finger, middle finger, ring finger, pinky finger, palm of the hand, the back of the hand, the whole right hand completely at rest. Feel sensation of the right wrist, forearm, elbow, upper arm, shoulder. Feel the whole right arm completely supported by the surface beneath it. Move awareness now to your left thumb, index finger, middle finger, ring finger, pinky finger, the palm of the left hand, the back of the left hand, whole left hand, soft, completely at rest. Feel the left wrist, forearm, elbow, upper arm, shoulder, whole left arm completely at rest. Bring attention to your shoulder blades. Feel the right shoulder blade, left shoulder blade, space between the shoulder blades, sinking in as you exhale. The mid-back and the lower back. Feel your whole spine completely supported. Breathing in, imagine space between all the vertebrae, healthy spine. Exhaling, softening all the muscles that work hard to support your spine. Become aware of the pelvis, the right hip, right thigh, knee, shin bone, ankle, foot, right big toe, second toe, third toe, fourth toe, pinky toe, the sole of the right foot, top of the right foot, whole right foot and ankle completely at rest. Feel the calf muscle, the back of the knee, the hamstring, and the right glute. Feel the whole right leg completely supported, resting on the earth. Move awareness now to the left hip, thigh, knee, shin bone, ankle, foot. Left big toe, second toe, third toe, fourth toe, pinky toe, the sole of the left foot, the top of the left foot, whole left foot completely at rest. All the little bones and the muscles soft. Moving up the left calf, back of the knee, the hamstring, left glute, whole left leg and hip completely at rest. Feel your pelvis, both hips, the pelvic bowl, the pubic bone, the lower belly, navel center. Breathe into the belly. And as you exhale, feel the whole abdomen soften and release. Become aware of the solar plexus, the space just beneath the ribs, the rib cage, chest, heart center. Breathing in to the upper chest. As you exhale, feel your ribs and your chest soften. Your shoulders soften. Your collarbones. Feel your throat. The muscles of the neck. Back of the head, the crown of the head, forehead soft, temples, cheekbones, jaws releasing. Noticing the ears and the ear canals. Softening the lips. Relaxing the tongue. Feel the bridge of the nose. Feel the breath as it moves in and out through your nose. Feel the eyelids heavy. Muscles of the eyes soft. Softening the gaze. Softening the muscles of the forehead. Whole face and head relaxed and at ease. Feel the whole body completely at rest, completely supported. Letting go. Taking a breath in, feel the whole body expand. All the way out to the very edges of your body. Breathing out, feel the whole body rest. Letting go, letting go, letting go. If you like, you can stay here longer. And continue to rest. If you feel ready to come up, taking your time, take a breath in. Again, feeling the breath expand all the way out to the edges of the body. As you breathe out, letting go of the breath, letting go of the practice. Gently begin to wiggle your fingers and your toes. Bring small movements back into your body. Gently rock your head side to side. Taking your time in a way that supports your back. Start to draw your knees back in. You might have to push your cushions away with your feet. And begin to roll over onto your side, adjusting your cushioning for your head as necessary to support your neck. Take a moment to pause there, feeling grounded, supported. And if you're ready to come up, slowly, move slowly. Use your hands to walk yourself back to seated. Coming up with a long spine, let your head and your neck be the last things to come up. And find another comfortable seat. You might even move back to a chair or move to your cushion. Finding a tall spine, maybe resting with your palms in your lap, or you can come back to our Mudra with the thumbs up, pressing down with the pinkies, Adho Merudanda Mudra. Softening through the shoulders. Take a moment again to check in with your spine. Check in with your breath. Notice if anything has shifted or changed in the body, the mind, or the breath. Bringing hands together at the heart. Take a deep breath to lift your heart. And exhale to bow the mind to the heart, honoring yourself for taking this time for self-care, to connect with your body, to befriend yourself. Om Shanti, Shanti, Shanti. I wish you peace and health. Join me again next time. Take care. Thank you.